Hi, my name is Jessica Ryan, and I'm doing my case study on Rocky Mountain spotted fever. The patient presented to her primary care physician as a 62-year-old female with blurry vision, body aches, a low-grade fever, and a tick bite. The patient is an avid yard worker that works in an office environment with a history of pernicious anemia. The doctor ordered a CT and MRI with no visual abnormalities, a CBC and comp with the results returning normal, and a tick-borne disease panel by PCR, which included Lyme disease, Rickettsia, and Babesia that also returned normal. The doctor ordered a Rocky Mountain spotted fever by PCR that included IgM and an IgG phase. The IgM returned abnormal at 1.85, and the IgG returned normal as 0, which is negative. The doctor diagnosed the patient as a new onset Rocky Mountain spotted fever due to IgM being elevated and IgG being negative. The patient was exposed to an infected American dog tick while doing yard work. The patient was treated with doxycycline, symptoms resolved, and the patient returned to normal. What is Rocky Mountain spotted fever? It is caused by a bacteria called Rickettsia rickettsii. Cases occur throughout the United States, but most reported in southeastern states. Cases typically occur during early spring and summer. The signs and symptoms are like flu-like symptoms. Blood tests can diagnose Rocky Mountain spotted fever, and due to the length of tests, the doctors usually start you on antibiotics before the test results. There is no vaccine. The best way to prevent Rocky Mountain spotted fever is to check yourself and your dogs and cats for ticks. Rickettsia rickettsii is a gram-negative coccobacilli. It's an obligate intracellular parasite. It's never grown in cell-free media. It's arthropod-borne. It can act as both a vector and a reservoir. The vector is ticks. It can cause flu-like symptoms. It can cause a rash on the palms of your hands and the soles of your feet, and if it is left untreated, the mortality rate is 20%. In conclusion, Rocky Mountain spotted fever can be difficult to diagnose. The symptoms typically resemble many other disease processes and require a thorough patient history. If left untreated, death could occur.